Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have the founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have the founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach.
Founding fathers of the science of epigenetics, here to guide us in creating a healthier health journey, a better health journey. So hello and welcome everybody. I know we have lots of people joining us, whether you're joining us here live in the Zoom room, which we are super excited to have you here. If you have questions, make sure you raise your hand early, please. As at the end of yesterday's show, we had 8 hands up and 5 of them didn't pop up until 5 minutes before the show was ending. So we want to make sure that we know exactly how many hands we have so that we can accommodate the time in order to answer questions. So if you are out watching a live stream and you'd like to join us here live in the Zoom, you're welcome to do so by going to zoom.dailywithdoc.com. Again, that is zoom.dailywithdoc.com. Now, this program is being sponsored by Daily with Doc. On our website, you will find replays of previous podcasts, radio shows, TV shows. I'm not sure what we're calling these. Presentations, shows from Daily with Doc, and also Pharmacist Bin Bites. You will also find articles that are even more tools, resources to put into your toolbox to help you in this thing we call life and the health part of this journey. We want to make sure that if you were invited by somebody specific, that you get back with the person that shared this program with you. Now, if there's no one to thank, you're more than welcome to utilize our website to the fullest And for everybody, you're welcome to join our email. Then you will be getting notifications of when we're going live, what we're going to be talking about, and also information about the previous day or week. So we just want to make it as hurdle-free as possible in helping people get the information they need to make the right decisions in making U-turns so that they can have a better health journey towards optimal health. My name is Becca Dukes. As the hostess of this program, a leader within the company called Longevity, and the director of student services for the Institute of Holistic Health, it is my honor and privilege to be able to host this show as a resource to an amazing community. This amazing community is made up of certified holistic health coaches and students working to become certified holistic health coaches. Now, our coaching program is open to everybody. If you'd like to get more information about that, you can get back with the person that shared this program with you. They may have their own personal link to share, but if nobody shared this program with you, you are encouraged to go to coachwithdoc.com. That is coach, WITHDOC.com. Now, without further ado, it is my honor and privilege to bring to the world the man of the hour. This gentleman has done so much in his lifetime, starting as a young child, just being observant of the things that were going on when there was the good stuff going on, bad stuff going on, and what type of things, were part of that mix, and going through helping himself overcome some challenges as a child so that he could be a productive individual in team sports, going on to be a pathologist into pathology as he was working his way through college, where he got a Bachelor of Science in Plant and Soil Sciences, also a doctorate of veterinary medicine. He has 3 postdoctorates in pathology, and if that was not enough, a naturopathic physician. He is also one of the founding fathers of the science of epigenetics. Now, epigenetics is the death of the genetic theory of disease transmission. He has proven that so many poor health conditions that have been said to be genetic, that there's pretty much nothing you can do about it except for manage symptoms, is wrong. Yep, it's wrong. So if you have even the most common things, blood pressure, blood sugar issues, arthritis, Alzheimer's, dementia, cholesterol problems, heart issues, and today we're going to be focusing on blood issues. Now, Dr. Wallach.
Yes, ma'am.
Let me get you up on the screen. Let me get you up on the screen with me. And there you are. So this is one of your 25 books that you have written and published. This one being Black Genes Lie. I wanted to say Black Genes Don't Lie, but you got Dead Doctors Don't Lie. Black Genes Lie, Slave Quarter Cures. Now, when we're looking at the blood, Dr. Wallach, there's some things that have been said to be genetic or culture related, or because of the color of the skin. And I just want to read from page 86 in this book that says, while working on a large multi-million-dollar NIH training grant, the Center for the Biology of Natural Systems at Washington University's St. Louis, Missouri, Wallach, that's you, was able to identify sickle cell anemia in white-tailed deer, folks, and further discovered that it could be reversed by the supplementation of the trace mineral selenium. Since 1991, Dr. Wallach and Dr. Milan have worked with the Sickle Cell Foundation of Georgia through their genetic counselor, Phil Oliver. They learned that by providing all of the essential nutrients on a daily basis and adding extra selenium to the individual supplement program, that their sickle cell disease goes into remission. They generally have an improvement in their quality of life, and they do not suffer painful or life-threatening attacks. Sickle cell patients on their supplement program claim more energy, better sleep, fewer pain attacks, fewer hospital visits, significant increases in hemoglobin and what's that? Hematocrit? Thank you. Levels. Feel more rested after sleep, increased appetite, significant increase in physical strength, and less susceptibility to infections. It is obvious from their experience, and I'm doing this in third person. He wrote it in first person, that the sickle cell problem is not the simple genetic disease that it was thought to be, but rather the clinical expression of the sickle cell trait may be a manifestation of a deficiency disease. So, Dr. Wallach, let's talk about the blood. And welcome to Daily Talk, Doc.
We're talking about what?
The blood.
Oh, the blood. Well,
you know, the life force within us.
Okay. Well, sickle cell anemia, again, has been thought from the beginning because it wasn't fixable with the standard approaches with anemia medications and so forth. And so they branded it as a genetic disease. It's not a genetic disease. Sickle cell anemia is very simple nutritional deficiency. And it's one of those things where it can happen regionally when there's things deficient in the soil, where they grow their vegetables and that kind of stuff. Okay, and they're not supplementing. And so you'll get a whole lot of kids with sickle cell anemia and teenagers with sickle cell anemia in those areas, but it's easily gotten rid of. Okay. We do this all the time, been doing it for 50 years, getting rid of sickle cell anemia. Very easy to prevent, very easy to get rid of. It's not genetic. It's a simple nutritional deficiency disease. And so what I want people to do is remember, when you have a child in a pregnancy, you got to make sure the mom is getting all the 90 essential nutrients during pregnancy. Just eating well isn't good enough. And when the baby's born, in addition to the formulas, which we sued the FDA 8 times in federal court to make sure they got the vitamins and minerals in the formula, so we're proud of that. That stopped a lot of sickle cell anemia. And then you want to add to that some things like kids toddy, which is a liquid. Kids think it's kind of like a fruit juice kind of thing, but it has all of the essential nutrients in it. Kids toddy, kids love it. Okay, and so whether they're 2 weeks old, 6 months, 6 weeks old, 2 months old, 6 months old, get them on the kids toddy. It tells you on the label how much per body weight. That's body weight. Okay, very important. And then you want to make sure especially if they already have it. Okay, we have Cal Toddy. 1 ounce of this per day will give you 92 to 95% of your daily requirement of calcium. And for a little kid, it's more than that. That's for adults, 92%, 92.5%. But for little kids, it's 100%, 110%. We also have and it tastes very kids love it. It's like candy. OsteoFX. It's another calcium product. So use this in addition to, if you're talking about a teenager or something like that, and they want to have something a little different in the day. Okay. So I take both of these every day. I'm 85 years old, but I still take them every day. Okay. It's one of those things. My supplement program is pretty complete.
Yeah, I take the Tangy Tangerine every day, the OsteoFX every day. I do like the liquid concentrate, Dr. Wallach, because it's just 2 tablespoons and you're done.
Yeah, it's amazing. And then I want you to understand that sickle cell anemia is not genetic. And it's called sickle cell anemia because the red blood cells, instead of being round like a donut, it looks like a quarter moon. Okay, it's a crescent. Okay. And this means that the bone marrow is not getting what it needs to do its job in these little kids and teenagers. And so we have, again, the kids toddy, and then you add to the kids toddy the let's see here. Okay.
There's the Cal toddy.
Cal toddy and the other one. OsteoFX. Okay. And so it's those two added to the kids toddy for these little bitty guys, especially if they already have sickle cell anemia, it begins to go away immediately. The bone marrow is a very active tissue. It makes red blood cells, it makes white blood cells, it makes platelets. Okay. It actually helps make and maintain the health of the bone itself. And so this is something that doctors leave out. They don't think about this dynamic tissue, the bone marrow, and it is so sensitive to nutritional deficiencies. I also like to throw in the chewable I-26, okay, because it's good for the immune system, but it's also good for the bone marrow. There you go. There you go. I had 3 this morning, so I'll be looking forward to lunch. Later on, so I'll have 3 more. Okay. And kids like the I-26, the chewables, because they taste like candy, but they're not candy. They're actually a very, very heavy duty supplement that's very good for the brain, the spinal cord, and the bone marrow. The brain, spinal cord, and bone marrow. Very, very important. And we should not have any long-term sickle cell anemia patients in America because we can get rid of it in just a couple of weeks. I don't care if you've had it for 3 years, 5 years, 10 years, we can get rid of it. Because it's the same way with diabetes. You can have diabetes for 25 years, and we can get rid of it in 2 weeks with our supplements.
Yeah. So one thing I wanted to mention, because I had mentioned the 2 tablespoons that I take and I'm done. Now, this is by weight, right, Dr. Wallach?
Yeah,
so if
weight.
you've got a 25-pound kiddo, you're not going to do 2 tablespoons, but you're actually going to use half a tablespoon.
Yeah. Read the label. It'll tell you how much. Okay. And a body weight thing. And so this is very, very scientific. And again, we should not have anybody getting into grade school with sickle cell anemia. It should be dealt with long before that. But you'll get people that move into an area and they've got kids. Oh yeah, my kid's got sickle cell anemia. Well, don't worry about it. It's not genetic. They're not going to pass it on to their kids if they straighten up their diet. Okay.
It's not contagious.
And not contagious. It's not an infection. It's due to simple nutritional deficiency. A simple nutritional deficiency. And I have had so many grandmothers hug me, okay, because we have helped their grandchild, because they were being blamed, passing on the gene, right? The grandparents were being blamed, and the grandmothers were being sort of ostracized. And once we got it fixed and people knew that it wasn't grandma that did that, it was the lack of the nutrition in the diet, okay? And so this is where the bone marrow is a tremendous tissue. You think about it, makes red blood cells, white blood cells, platelets, antibodies. It helps build the bone itself, cartilage, ligaments, tendons, connective tissue. And so bone marrow is something you want to really pay attention to and make sure you're giving it everything it needs plus. You can also look at the book, Dead Doctors Don't Lie, a Let's Play Doctor, the metabolic syndrome. Okay, metabolic syndrome. You have abdominal obesity, type 2 diabetes, hypertension. And then there's a list of about 50 different diseases you can get when you have metabolic syndrome. 1/3 of American adults, 1/3 of American adults, 1 out of 3 has a metabolic syndrome. And it was actually talked about at first in the old Bible, the Old Testament, 2,000 years ago. I didn't name it the metabolic syndrome, but they're talking about people with blood sugar problems, high blood pressure, belly fat, and all these other diseases. Okay.
Doc, before you go deep into that, I have a question. So let's talk about that when we get that question. Okay.
Okay.
But I want to kind of focus on the blood right now. And I have a question in regards to that. Now, you mentioned the cow toddy and the OsteoFX. Both of them are bone building products. because the blood is manufactured in the bone marrow, which is within the bone, is that why you're recommending both?
Yes. Okay. It's two different sources of calcium. Okay. And I always like two different sources of things. Okay. Because who knows what's going on inside. And so you want to make sure that the bone marrow is getting the calcium from different sources, getting all the other minerals and trace minerals from different sources. And this is why we put the plant-derived minerals in so many of our products for kids and so forth, the plant-derived minerals. I put that in my mixture. And when you look at the kitchen table where I sit for my meals when I'm at home, there's 40 different bottles there on the table. And I take those twice a day, actually 2.5 times a day. Okay, because there's so many, it fills up one of those bottles. And another thing that you need to throw into the system, that I already talked about, the chewables, okay? The chewables. Oops, let me show you what the chewables look like.
Oh, I got it right here, Doc.
Yeah, show them a chewable. Okay.
I'm going to show them because it's time for me to take mine anyways. I missed it. So
Okay.
It's like the size of a quarter, a little bit thicker. There's 2 flavors, either vanilla, French vanilla, or coconut banana. I prefer the French vanilla. Most of my clients prefer the French vanilla too. So easy to chew. And it also, if you don't want the chewables, because there is a little bit of sweetener to make it sweeter, there is the French vanilla powder that does have less of the sweetener in it. In fact, there's only 0.5 grams of carbohydrates in this, folks. It's almost 100% high, or is high, almost 100%, because it tastes like vanilla still, of hyperimmune powder, which the I-26 represents the 26 different pathogens that it addresses. And Doc likes it because it's 25% of your recommended daily allowance of what, Dr. Wallach?
Selenium.
Cholesterol.
Oh, cholesterol. Yeah.
That's why you like it, right?
I-26 cholesterol. Also, you need the vitamin D3. I take 2 or 3 of these twice a day, little bitty white capsules. Okay, vitamin D3. That's going to help the sickle cell anemia very well. Otherwise, you have to have the kid out in the sun for a half hour twice a day with no clothes on. Well, this will help them. They can just take the vitamin D3 2 or 3 times a day. And this is heavy duty stuff. Okay. When you look at this, I'm going to read this so I don't make a mistake. Just 1 or 2 numbers. Okay. When you take one of these capsules of our vitamin D3, okay, you get, let's see here.
I think it's 5,000 IU, Dr. Wallach.
You get 625%. 625% of the vitamin D3 you need if you just take one of these a day. I take 2 or 3 twice a day, okay? Because I don't get out as much as I want to, because we have all these things going on TV and the screen and talking and the phone and in clinics and in offices and in homes and stuff like that. So I don't get out in the sun as much as I like to. So we came up with this high dose vitamin D3, and I take 2 or 3 of those twice a day. And so I don't have any clicking in my joints. Okay, I'm 85 years old, and nobody's going to take me. I don't care if they're 300 pounds. I'll take them down. Okay, I know how to do it. I lettered in wrestling in junior high, high school, and university. Okay, and spent 20 years in the military, retired lieutenant colonel in the military. So taking my supplements is an amazing thing for somebody who's 85. Most people say, what, you're what? You can't be 85. Well, I am. And it's one of those things where you give your body what it needs. It's just like your car. You put in high-grade oil and high-grade coolant in your car, it'll last a long time. If you just put water in your tank, and okay, or your radiator instead of coolant, if you just put a little bit of kerosene or something like that in your car instead of gas, the high-grade gasoline, it's not going to last very long. It's going to burn up. Okay, you do the same thing. So you have to make sure you're getting all the right stuff on a regular basis, and your body will be tireless. Your body will go on and say, what are you taking? You taking some drugs or something? You're still so energetic. We've been working with this all day. Everybody else is laying out there panting like a overheated dog, and you're out there just working away. What's going on? And I freak people out how much I can do out in the sun, because I take all my nutrients, I avoid all the bad stuff. And again, sickle cell anemia is an easy one to prevent in your family, just prevent it. But if you get it, it's easy to get rid of in some cases days, but certainly weeks. But you have to stay on the program. You can't quit. Well, okay, now we can quit taking all these nutrients. You got to keep taking them. Otherwise, a month or 2 or 3 later, when you get rid of the ones that are stored, it comes back. Say, oh, there you go. It's genetic. It keeps coming back. Well, that's because the food you're eating and from that area don't have the nutrients in it because they're missing. Soil is not equal all over the world.
So, Dr. Wallach, we've got a question wanting a little bit of clarification, because you've said in the past that if you catch it in utero, you can get rid of sickle cell prior to the islets of Langerhans forming.
It's true.
So if mama takes the nutrients,
if mama
then
takes all the right nutrients, the baby will be not born with sickle cell anemia. Okay, the mama's passing all those nutrients on to the embryo. If the mama's not getting all the nutrients to get to the embryo can be born with sickle cell anemia. That doesn't mean it's genetic. It means that mama was deficient in the things that are required to make normal red blood cells and normal bone marrow, platelets, okay, white blood cells. And it's an amazing thing when you think about all the stuff that the bone marrow does, and nobody pays attention to it.
Yeah, it is amazing, Dr. Wallach. Now, we do have a question coming off of YouTube wanting to know what time is the best time to take a calcium supplement and why?
Well, I like a calcium supplement twice a day, once with breakfast, once with dinner time. And again, if you want to, you can take another shot of calcium, say 15 to 30 minutes before you go to bed, because the elevated calcium will help you sleep better, deeper.
And is the sickle cell anemia, is it reversible after birth?
Oh yeah, absolutely. I don't care if they're born with it, we can get rid of it. It's a simple nutritional deficiency, just like babies can be born with rickets. Okay, you get them all the 90 essential nutrients with some extra vitamin D3, and the rickets goes away even if they're born with it. Okay, same way with anemia, osteoporosis, rickets. Babies are born with all kinds of physical problems that are associated with a lack of white matter of the brain, because the mother was avoiding all the stuff that's required to make the white matter of the brain. So the baby got cheated. The baby's born with all these mental issues and physical issues, and you get them on the I-26. Okay, it comes in the powder, which you can mix in the baby formulas. It comes in the capsules, comes in the chewables. I like the chewables, like the one you popped in your mouth there, because I can take 2 or 3 of them in my pocket, and it's easy to grab and just throw in my mouth. I don't have to mix up and all that kind of stuff when I'm giving talks and so forth.
Right. Well, Dr.
Sickle
Wallach, we
anemia
have
is not a
many
permanent
answers.
thing. Sickle cell anemia is not a permanent thing. If you're born with it, we can get rid of it.
So that should be great news for a lot of people. Now, Dr. Wallach, sickle cell anemia has a different name for other cultures, and that's thalassemia.
Thalassemia.
Is it the same thing?
Well, it's a cousin.
Okay.
It's a cousin.
So it's not.
It's
So
not
it's a cousin.
the same as sickle cell anemia. It's a cousin.
All right. Well, Dr. Wallach, I know the next hand or the first hand that is up has another question in regards to blood. Folks, I hope that you are really paying attention and realizing that what you've been told, that you're stuck with something, is probably not wholly truthful, because there's a lot of things that you can do as an empowered individual in your own life, in the life of your family, and then moving into the communities to help build a better health journey where pain and demise does not have to be because of poor health. So get back with the person that shared this program with you. Tell them thank you, what you learned or liked best about what you've heard so far, and ask them how you too
can start your better health journey. And we're always looking for people to help in this crusade in building stronger communities. And in doing so, you can get a thank you check. So ask that person how you can be part of the solution. If there's nobody to thank, give us a call at 855-949-3377. Again, 855-949-3377. Or for those who prefer to text, you can also text that phone number or email info or questions at dailywithdoc.com. Again, questions at dailywithdoc.com. Jill, go ahead and unmute yourself.
Hello there.
How are you today?
I'm doing fantastic. Thank you for
Can't
taking
wait
my
to connect.
Hi.
Yes, I know. I can't wait to see you too, Becca. Talking about the blood, I have a customer who is asking about white blood cells. Apparently she's been told that she has low white blood cell count, and she wants to know what we can do about it.
Okay.
She also happens to be Amish. I'm not sure that's relevant, but I'm just mentioning
No,
it.
it's not relevant because it's more to where they live. Okay. Well, they're not putting wood ashes or coal ashes into their gardens anymore. They're not putting wood ashes in their food anymore. They're not taking supplements. And so they can have white blood cell, what should I say, a reduced level of white blood cells. Okay. When optimal levels of white blood cells to defend you against viruses, bacteria, fungus, and yeast, and all that kind of stuff. You think about all the stuff that your bone marrow does. It needs a lot of stuff. Okay. And just eating hamburgers or eating waffles or eating pancakes or eating things like pizza, that's not going to cut it. Okay. You got to get rid of all the bad stuff and take all the good stuff. And then, of course, you want to take all the things that are going to make the white blood cells happy. Okay. And so, again, the 90 essential nutrients to how the brain and heart pack. Do we know how much she weighs?
I do not. I'm going to guess 150.
150. Okay. So a medium-sized person. So I'll have her take 2 healthy brain and heart packs per month. Take a full dose of everything at breakfast, a full dose of everything at dinner time. Then she also needs the Ultimate Daily Classic tablets. Take 3 of those twice a day. That will increase blood flow to the brain, to the heart, to the kidneys, the liver, all the other tissues, and the bone marrow. And then you also need to take the, I would go, let's see here, with the Rebound for energy, not on soft drinks. All the bad stuff's got to go. No fried food, no processed meats, no oils, no gluten, no wheat, brown oats, no buckwheat, no sugar, no carbonated drinks. Even that one's got to go. So you get the box containing 30 of these servings of Rebound, which we made for Theo Ratliff. Okay. These a day. Okay. And it's one of those things where my energy level is always up here because I take 2 of those a day. So I go through 2 of these boxes a month. There's 30 in a box. Okay. So if you take them twice a day, this will be 2 weeks worth. Okay. And it's one of those things where so say, where are you getting all your energy? Because they're going to be exhausted in the middle of the afternoon or the middle of the morning. And you're just out there just doing the work of 3 people. Okay. Because you're getting all these nutrients. And it's one of those things where, you know, I feel pretty good at setting an example, being 85 years old and still being able to work 20 hours a day. Or 20 hours a day. I might take a little bit of a nap in the afternoon, maybe sometimes if nothing's going on. But if something's going on, I don't take a nap. Okay. And so on the weekends, I'll have more of a sleeping thing. Instead of just maybe 4 or 5 hours, I'll have maybe a 6 or 7 hours sleep. Okay. And it's one of those things where I deal with so many communities all over the world. So many communities all over the world. And we have now also found the cause, prevention, and reversal of one big class of nutrients. Okay. And we're talking about the white matter, the brain and spinal cord, Alzheimer's disease, Parkinson's disease, multiple sclerosis, ALS, Huntington's chorea, frontotemporal dementia, Bell's palsy, cervical spondylosis, optic neuritis, Charcot-Marie-Tooth. Okay, and I could go on and on and on, but you get the idea. You have this flip chart. It covers all these different diseases that are caused by deficiency of the myelin. There you go. Okay, 90 for Life Crusade to save humanity in the world. And it has, I don't know, about a dozen famous people, movie actors, very famous teachers, very famous, let's see here, professional athletes. We're talking about all kinds of people who are famous. Huh? Who?
Politicians too.
Oh, famous politicians, right? Who had terrible diseases. They were near death, and the doctors didn't give them much time. And one of our people would give them our program, okay, with the 90 essential nutrients, including the I-26. And in weeks, they're better. And in a month, they don't have the problem anymore. And so this is why we let people know, okay? And they contact us at Wellness Publications. You got on the screen there. What is it? 1-800-755-4656, 1-800-755-4656. Okay, and that gives you the telephone number and the email address at www.drjwallach.com, www.drjwallach.com, and get a hold of this stuff, okay? And this will work for you too. We've been doing this. We have literally now a very interesting thing going on with Parkinson's disease. For 100 years, we're getting 60,000 new cases a year in America. 60,000 new cases a year in America for 100 years. Well, last year, it jumped up 50% to 90,000. Okay? That's because doctors were giving people anti-cholesterol medication. Well, cholesterol makes up 85% of the myelin in the brain and 95% of your sex hormones. So you don't want to be taking something that's going to lower your cholesterol. You just don't want to eat cholesterol that's fried. Cholesterol is one of your best friends. It makes your sex hormones for both male and female, and also helps make the white matter, which is 85% of your brain and spinal cord weight. You do not want to be cholesterol free. You do not want to be taking anti-cholesterol medication. Do not do that. Just don't fry it. Just do not fry cholesterol.
So Dr. Wallach, going back to Jill's client with the low white blood cell count, would you recommend, because it has to do with the bone marrow, things like the MSM Ultra and the collagen?
Oh, absolutely. I mean, we've got 2,500 products. Okay.
Oh, I understand that. Just
yeah, absolutely. Go ahead and take that. That's going to make your bone marrow happier and work more efficiently. And this is, you have to appreciate that the bread and butter for doctors are the bones. We pay them just to treat the symptoms of arthritis in America each year, $626.8 billion. And that's just to treat the symptoms of arthritis, not to cure it or prevent it. And when it comes to things like osteoporosis, when you combine us with the European Union and Canada, the three nations each year, just to treat the symptoms, spend $6.7 trillion, not to prevent or cure it. So you take our program and we can get rid of, I don't care how long you've had arthritis, I don't care how long you've had your osteoporosis, it goes away and begins to go away in weeks. Yeah, that's what I say. Give me 90 days. Give me 90 days and you'll see miracles. We'll give all the credit to the good Lord. We're just following his rules. And when you follow his rules and use his products, guess what? Good things happen. Good things happen. You know, it doesn't matter if you're white or black or yellow or red, doesn't matter what your basic background is. As long as you're staying away from the bad stuff and you're doing all the good stuff, all mammals, whether you're a whale or a rat or a raccoon or a rabbit, okay, and even birds like crows and parrots and other pet birds and things like that, they require all these nutrients. And if you're just giving them seeds, okay, the birds, they're happy, but they're not getting the nutrition. And so they die early and get sick and on the perch and all this kind of stuff. So it's one of those things where that's why the land flowing with milk and honey is so famous. Okay, because people live to be 200, 300, 400, 500. It's written up in the Bible. You cannot disagree with what's written up in the Bible.
Right. Well, Dr. Wallach, thank you so much for that. And let's go to the next hand that is up. And Keely, go ahead and unmute yourself. Hi, Keely. Can you unmute yourself?
Is Keely?
Okay, I finally got it. What do you
There
know?
she
How
is.
are you? It's an honor to talk to you, Doc. How are you today?
Okay, how can we help you?
I have two
Keep
situations. I
going
have
to
a
the microphone. Don't turn away from the microphone.
okay. I have a 75-year-old male, 6 foot tall, 185 pounds. He had glioblastoma about 15 years ago, and he is just had a seizure. And they said the seizure was due to scar tissue. He also has dementia. Well, they basically diagnosed him with dementia and possible Alzheimer's, is on Alzheimer's medications, no statins that we know of. Is there anything that you could suggest to deal with the scar tissue that is there, given the fact that the glioblastoma is no longer present?
Okay. Now, did he have anything going on did he ever complain about ringing in the ears and balance problems?
Balance problems, yes. And dizziness. He's got weakness now, obviously. He did lose some weakness on the right side of his body.
Okay, I'm sorry, he's got what?
He had weakness on this right side of his body from the last seizure, which they said was from the scar tissue.
Okay. All right. So you get rid of all the bad stuff. No fried foods, no processed meats, no oils, no gluten, no wheat, butter, iron, oats, no buckwheat, no sugar, no carbonated drinks. The diet one's got to go. Needs to have 2 healthy brain and heart packs per month, a full dose at breakfast, full dose at dinner time. Then needs the ultimate daily classic tablets. Take 3 at breakfast, 3 at lunch, 3 at dinner time. That's going to help blood flow through them blocked arteries, go into the brain and the heart and the lungs and the liver and all the bones and legs and so forth. And then need the I-26. Go ahead and take 3 of those chewables at breakfast, lunch, and dinner. If you prefer, you could take 3 of the capsules at breakfast, lunch, and dinner. We do have the powder. Okay. And then, okay. And it's one of those things where you need to make sure that I like the rebound. Okay. I also like, in this case, I would also get them the de-stress capsules. It's good, particularly for the heart. It goes along with the Ultimate Daily Classic tablets, the de-stress capsules. Okay. But the I-26 is going to really help very much with the stuff going on in the brain and the nerves and all that kind of stuff. And also the bone marrow. Okay. So let's go that direction. Okay.
Okay, I'll get back to you on that one. And my last one is a 74-year-old female, 155 pounds, 5'6". She was an Air Force nurse, and she actually ended up with hepatitis from a patient's needle. She had a liver transplant from her son. She's on anti-rejection drugs, but they're sort of wreaking havoc on her body. Half of her liver, she's told me was, as she says, is there a way that I can sort of restore myself, given the fact I'm on these drugs, and half of that liver is my son's, but the other half obviously is from my husband. She says, is there any way that I could basically recover to have some level of quality of life?
Yes. Get rid of all the bad stuff. No fried foods, no processed meats. That means your husband, your kids, and your dogs, everybody living in the household's got to be in the same thing. No bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat, butter, iron, oats, no buckwheat, no sugar, no carbonated drinks. And the diet one's got to go. And then 155 pounds or thereabouts, you need 2 healthy brain and heart packs per month, full dose, everything at breakfast and dinner. That will really, really support the brain, the heart, the liver, kidneys. Don't forget the Ultimate Daily Classic tablets. Take 3 of those twice a day. That will also help the circulation to all tissues, including the liver. And then I would also throw in extra selenium. Throw in a little bit of extra selenium. Take an extra 2 or 3 of those twice a day, in addition to everything else you're taking. And don't forget the rebound for your energy. The rebound, I weigh, depending on the day and whatnot, 138 to 142 pounds. And I take 2 of those rebounds a day, one at breakfast and one early in the afternoon. Okay. And so it takes me about an hour to drink them. I don't just slam them down. I kind of sip on them for an hour. So you're going to be really absorbing them slowly and significantly. As rebound, they come in little sticks like this. I take 2 of these a day. They come 30 in a box. So I have to use 2 boxes a month. Okay. And so you're, what should I say? Glia, you're talking about brain and nerves and all that kind of stuff. Don't forget the I-26. Really, you must take that. Very, very important. Okay.
Okay. All right. Thank you very much, dear. Have a great one.
You bet. Give us a call every couple of weeks. Let us know how these folks are doing.
Most certainly. Thank you.
Yep. Yeah. People like to hear whatever happened to those people that, that had this, whatever happened to people that had that. And so it's good to have a little bit of feedback so they can hear.
Awesome. Thank you so much, Keely and Dr. Wallach. I moved on before we were quite ready, as Jill had another question. So I want to make sure that we get to that, and then we will be going on to Coach Rad and AJ. So let's try to move through these as thoroughly but quickly as possible, Doc. Okay. Jill, can you unmute yourself?
I can. As
Awesome.
luck would have it, I potentially may have just gotten my answer from him. My question was for somebody who has autoimmune hepatitis. Now, I can't say I know a lot about her. Her mom just brought this issue to me, and I haven't started to work with her yet. But I don't know if that's different or different advice than you just gave, but
It would be the same thing as the lady that had the liver issues. Okay.
I figured it was.
But since the hepatitis, anytime you have itis, it could have an infection involved, some bugs involved, like viruses or something. So here's a case where you might want to throw in the colloidal silver. We have the colloidal silver with the dropper top. Okay. Put a dropper full under the tongue. Right side, dropper full under the tongue, the left side. And I do that 10 minutes before breakfast, 10 minutes before lunch, and 10 minutes before dinner time, and 10 minutes before bedtime. I've been doing it for like 40 years. Colloidal silver has been used to kill bugs, viruses, bacteria, and things when they didn't even know what they were, but they knew they were bugs, little things you couldn't see with your eyes, but would kill you. For 400 years, they were able to take the colloidal silver into a village that was just collapsing, okay, from an infestation of some plague. And they go through and give everybody colloidal silver, and in 2 weeks' time, they were all perfectly normal. Okay, so this goes back 400 years. And so it's a non-prescription, I don't know if you call it a supplement or a drug, but it's been around a long time, and nobody can say anything bad about it because it doesn't taste bad. It has no alcohol in it. You can put in baby's eyes, you can put it in an open cut because it won't sting because there's no alcohol in it. And it's a great product. Every family should have at least a couple of bottles, one in the bathroom, in the bedroom, main bedroom, and one in the kitchen. Okay, maybe 3, one out on the porch or something like that. You need to have that colloidal silver, easy access, and teach the kids how to use it. Just make sure they know that they're limited to a dropper full under their tongue. Okay, if they're a little guy. If they're a teenager, they can have 2 droppers full under their tongue, one on the right side, one on the left side.
Now, Dr. Wallach.
Yeah, it just tastes like water. Just tastes like water.
I would tell you, I had 2 success stories just last week with colloidal silver. One who had pink eye, and it was an adult who was exposed to pink eye. And the other one was someone who felt they had an earache coming on. And in both cases, I was able to help them with colloidal silver. So thank you. I had someone today tell me that she, in the winter, gets a lot of
colds
fever,
and pneumonia and
fever.
all the throat.
She gets fever blisters. Would colloidal silver be helpful for that as well?
While I was talking, I didn't hear.
Oh, sorry.
No, that's right.
I asked about colloidal silver since you were talking about it. I had somebody come today that she says in the winter in particular, she gets a lot of fever blisters, cold sores.
Yeah, exactly.
Would that be helpful for that?
Oh, yeah, those things are caused by viruses. And, I'm 85 years old. I've never had a fever blister in my life. Okay. and I hang around all these people who are sick during the wintertime. And I go to meetings where people are coughing and hacking, and they want to shake your hands and hug you and all that kind of stuff. And I just don't get sick because I'm taking my colloidal silver faithfully. I take my 90 essential nutrients faithfully. I take my rebound faithfully. Okay, never miss. Okay, you'll have to wait. I still have a few. Give me another 10 minutes. Okay, it's one of those things where you will be blessed if you really pay attention and be responsible and do everything correctly.
Thank you, Doc.
Yes.
All right, Doc, we have at least 3 more questions in the next 10 minutes. Let's move over to Rod. Rod, what question are you bringing to us today?
Good afternoon, Doc.
Hey, what's up?
I have a male, 6'1", 170 pounds. He has low blood pressure, kidney malfunction, and liver malfunction.
Okay, kidney, liver. I missed the first one.
Low blood pressure.
Oh, low blood pressure.
Yes, sir.
Okay, 170 pounds. Now, got to get rid of the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, no rhinos, no buckwheat, no sugar, no carbonated drinks. Even the diet one's got to go. And then 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month. If that's a little financial thing for them, have them take 2 of the ultimate, what? Help me out here. Because
If 2 healthy brain packs are too much to take 2 bottles of the Ultimate Daily Classic, or 2 doses of just the Tangy Tangerine?
Yeah, just the
Healthy Start Pack.
say again.
2
Healthy Start
packs.
Pack?
Yeah, there you go. Healthy Start Pack. Yeah, the Healthy Start Pack. Go ahead and take 2 of those a day. Okay, it's a little bit cheaper than the Healthy Brain and Heart Pack. Okay, and then the extra, because you got liver problems, needs the extra selenium. Take 3 of those twice a day. You also need the de-stress capsules. Take 3 of those twice a day. Additionally, don't forget the rebound or sports drink for the energy. And the nice thing about it's not carbonated, and it's very easy even for little kids to mix up. Okay, and the blood pressure, it comes down when the bone marrow is happy, the heart's
What
happy.
about, Doc, what about when the blood pressure is already low?
When the blood
Because
pressure
this
is low,
individual's
oftentimes it happens because they have not enough protein in their diet. They're just eating fruit and berries and vegetables and stuff like that, and they eat a little piece of meat the size of a quarter. They need 3 eggs for breakfast. They need the I-26, and that will bring the blood pressure up into the normal range.
good to know. Rod, did you have any other questions?
No, that's all. Thank you so much.
Hey, thank you, Rod.
All right. Thank you, Rod. And let's move right over to AJ and Dr. Wallach. I don't know if you know it, but we also have a product specifically for liver from the Pollen Burst line that's called Daily Liver Formula, which I personally know somebody that has gone from stage 4 or 5 cirrhosis, liver cirrhosis, to in 5 months not having cirrhosis or any signs of it at all. So,
Okay,
and that's
daily-
adding the
Daily liver formula.
that's adding the Daily Liver Formula to the Brain and Heart Pack, Doc.
Okay, that's one I haven't used very much. I'll give it a try the next time I run into somebody that needs that kind of thing.
Awesome. AJ, what questions do you have today?
Oh, Doc, I hope you got your thinking cap on today.
Okay.
All right, so we have first a question that was emailed in. Galindo says, I'm 73 years old. He's looking to lower his blood sugar. He's on 2 different drugs, metformin and pioglitazone. And he wants to help get better blood sugar
Okay.
levels.
Do we know how much he weighs?
I don't have any of that info. I'm sorry, Doc.
Okay, well, let's just go for per 100 pounds of body weight. Okay, get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, wheat, butter, rye, oats, no buckwheat, no sugar, no carbonated drinks. Even the diet one's got to go. 2 healthy brain and heart packs per month, or 2 healthy start packs per month, depending on their finances. Okay. I personally like 2 healthy brain and heart packs, and I have to pay for them like everybody else. I don't get them I don't get them for free. And then they need to, because of the sugar issues, I would take our sweeties, take 3 of those at breakfast and 3 at dinner time. And I take 3 sweeties twice a day. I don't have a sugar problem, but I take 3 sweeties twice a day anyway, because I don't want to get a sugar problem. Okay, kind of preventive maintenance there. And this works like a charm. I've been using this product in over 30 countries over 50 years, and people just love the sweeties. I take people who've been really down with really severe diabetes, type 2 diabetes, and we get them on the program, okay, with the sweeties, and in 2 weeks they're not a diabetic anymore after 25 years of being a serious diabetic.
Thank you, Doc. Angelica's client is 60 years old. She's diagnosed. She has a catheter on her right side, urethral stent. She doesn't have a right kidney. She's asking if she can do anything to detox her liver, given that she doesn't have any kidney.
Okay. And do we know how much she weighs?
None of that information. Sorry, Doc.
We'll go by, that's all right. We'll go by 100 pounds. So then get rid of all the bad foods again. No fried foods, no processed meats, no oils, no gluten, no wheat, butter, rye, oats, no buckwheat, no sugar, no carbonated drinks. Even the diet one's got to go. And then per 100 pounds of body weight, 1 healthy brain and heart pack or 1 healthy start pack, whichever is in their financial realm. I like the healthy brain and heart pack because it has quite a bit more stuff in it. And for the liver, I like the Ultimate Daily Classic tablets. It's good for circulation. It's good for anti-inflammation in the liver, the kidneys, the heart, the brain. And then I also like the I-26. We need 3 times a day, either the chewables, the capsules, or the powder. Okay. And that's gonna make the liver happy. And I also like the rebound for more minerals and vitamins, because it's just loaded with minerals and vitamins. The rebound, when you read the label, it's a whole side of the box. And then also in the drinking water, I like the Cal Toddy. I like the Cal Toddy. That helps calm everything down. The liver loves calcium. The kidneys love calcium. Okay.
Oh, that's excellent. Doc, last quick question from me is Harry is asking, how can we rebuild our stem cells, given that other companies offer some stem cell care? And since he's a loyal Dr. Wallach acolyte, he wants to know what you would use to help us to rebuild our stem cells.
Well, stem cells require, whether they're for liver, for heart, for muscles, for bone, for kidneys, brain, eyes, stem cells require nutrients, right? And so this is where you want to really be good with the nutrients. Get rid of all the bad stuff. We've said it enough times today that I think you understand all the bad foods, got to get rid of them. Then I would also, per 100 pounds of body weight, if they have a stem cell thing, I would go with the Healthy Brain and Heart Pack, 1 per 100 pounds of body weight. 150 pounds or more, I'd go with 2 a day, so you get full dose of breakfast, full dose of dinner time. Then they need also the Ultimate Daily Classic tablets, 3 of those twice a day, for getting circulation going into the brain and the heart and the kidneys and the liver. And then we also like, again, the rebound twice a day at least. If they're a big person, 150 pounds, 200 pounds, you might want to go with 3 of those sticks a day, 1 at breakfast, 1 at lunch, 1 at dinner time. But, take about 45 minutes, an hour to drink them. Don't slam them down in 3 minutes. Okay, sip on them so you absorb all the pieces. There's quite a bit of stuff there. Okay, and it's one of those things where you want to make sure that again, that I-26 is being used on a regular basis. The stem cells require the nutrients we've talked about. Your stem cells each organ makes its own new baby cells, and they're called stem cells. Okay, so you get stem cells for liver, you get stem cells for kidneys, you get stem cells for heart, and so on. So you need a broad range of things, because when you usually have one problem, the others are there, but they haven't shown up enough to compete with the bad symptoms of the main one you're looking at. Okay, so you got to be very, very, what should I say,
Diligent?
complete. You want to cover the territory. Okay, don't just take an aspirin. Okay, you can get rid of some pain with an aspirin, but it's not going to fix anything.
Now, Doc, you have a product called Immortalium that works with the telomeres. Is that something that this person should want to?
Yeah, absolutely. Immortalium is a very good product. Again, we have 2,500 products, and so that's one I probably should talk about more. But Immortalium is a great, great, great product, and because it does support the parts of the tissues, including brain, bone marrow, heart, kidneys, liver, bone marrow, all the stuff that makes you be healthy and live longer.
You're awesome, Doc. Thank you.
Well, thank you, sir. You're awesome.
We've got an awesome group, Dr. Wallach, and
You're awesome. You're awesome.
Thank you. I have one last question, Dr. Wallach. I know it's at the top of the hour, but we have a coach whose sister is suffering from abnormal chronic diseases, which I think you're going to say they're not abnormal, but she's suffering from high blood pressure, high cholesterol, type 2 diabetes, arthritis in her hips, neck, stomach ulcers. She's on a multiple different array of pharmaceuticals, which many of them I have found cause high blood pressure, cholesterol issues, blood sugar issues, arthritis, and ulcers and stomach problems, including she's on a statin. He says that he's been trying to tell her that these are chronic diseases due to vitamin and mineral deficiencies and poor diet, but they don't want to listen to him. So tell him, Doc.
Okay, well, here's, and did we know how much she weighs, or we're going to just go by 100 pounds?
We're going to go by 100 pounds, please.
Okay, per 100 pounds of body weight. Now, the first thing you have to understand is this gal has the metabolic syndrome. One out of three American, there you go. 1 out of 3 of American adults have the metabolic syndrome. It's classified first by abdominal obesity, diabetes type 2, and hypertension, high blood pressure. Those 3 things. If you have those 3 things, this is from the old Bible 2,000 years ago. Okay, that's when they first recorded it. Okay, but they have it in, what should I say, they have it recorded in other ways going back, 200,000 years, 300,000 years of the cavemen. Okay, and this book, Metabolic Syndrome, this lady should get the book, Metabolic Syndrome, get the book. It's all in your head. Get those 2 books and read them, and she'll be flabbergasted. But let's go by 100 pounds. She needs 1 healthy brain and heart pack per 100 pounds of body weight. If she take a half a dose at breakfast and a half a dose at dinner time. If she weighs 130, 140 pounds or more with the metabolic syndrome, I would have her take 2 healthy brain and heart packs per day to take a full dose of breakfast, full dose at dinner time. Then she needs let's see here. I'd go with, because she has diabetes, I'd also add the sweeties. Okay, take 3 of those twice a day. Okay, and then high blood pressure. What do you like for high blood pressure, Becca?
Ultimate Daily Classic, Dr. Wallach, and make sure they're taking those essential fatty acids.
Okay, Ultimate Daily Classic with fatty acids. Okay, Ultimate Daily
Essential fatty acids. Yes, like the EFA.
Yeah, I know.
Yeah, of course you know.
I'm gonna squeeze.
God bless you. God bless you.
But yeah, and the high blood pressure, again, you need the Ultimate Daily Classic. Is really works wonders with high blood pressure. Don't forget the I-26, good for the immune system, good for the brain, good for the spinal cord, good for the white matter, good for the heart, good for the kidneys, good for the liver. And it's one of those things where it'll go away. This collection of diseases, this puts them into the metabolic syndrome. Metabolic syndrome, you can have 50 different diseases. As long as you've got the abdominal obesity, type 2 diabetes, and hypertension, high blood pressure, you've got the metabolic syndrome. And all these other things are just jumping on you because your immune system is low and your nutrition is low. Okay, but it's all fixable. It's all fixable. You know, and actually, well, you just got bad genes, you got to deal with this. I can give you some kind of things to replace your aspirin to be a little bit stronger for you. No. Okay. Don't go there. Give your body what it needs to maintain itself, and you'll add 25 years to your life.
And
Okay.
folks, you can find the good foods, bad foods list on our website at dailywithdoc.com. You can find Dr. Wallach's books at drjwallach.com or give the phone number a call, 800-755. Tell them, Doc.
Okay.
I had it written down.
800-755-4656, 1-800-755-4656. The website is www.drjwallach.com, www.drjwallach.com. Not too bad for an 85-year-old guy.
Hey, Doc, we need you, okay? As you
Thank you.
can see, folks, thank you so much for joining us here on Daily with Doc. There were still questions that we did not get to. So if we did not get to your question, please email us at questions@dailywithdoc.com. Again, that's questions@dailywithdoc.com. I have some of my crew up here. Can I get the rest of my crew up? Oh, maybe I do have the whole crew up here. Well, fantastic. You guys are on the ball. Folks, I could not do this without my team. And I love the fact that we are able to work as a team and pick up where there is a need. So as we are seeing here on the screen, we have AJ, who usually is last, but he's up first. He is the one that is responsible for us being on all these different platforms. He is our digital marketing director, our DMD, in making sure that, that we are being easily found. So thank you so much for that, AJ. And also helps me a lot with the website, www.dailywithdoc.com. And we have Sherry, who is part of our technical crew, who helps to get the stream up and rolling out on Rumble, Facebook, YouTube, and watching those different platforms as well. Thank you so much, Sherry. We have Rod, who is out watching those different platforms and bringing questions in from the field so that we can make sure that everybody gets answers so they too can have a better health journey. Thank you so much, Rod. We have Ruth Ellen, who is my executive production manager, who keeps us all in line and scolds us when we're not, but we all have fun at the same time. And I know I'm calling you out. I love you. But she's also responsible for taking today's Zoom, putting the graphics. And for those of you who are watching us on any of the different platforms, what she has done is what you are seeing. So thank you so much, Ruth Ellen, for keeping that up, rolling, and going.
Welcome.
Did you want to say something?
And remember, there's no live show tomorrow.
I was getting to that.
Okay.
Yeah, I was getting to that. So, but thank you for the reminder. And we have Marilyn, who is using her skills as an amazing typist here in the live Zoom. So folks, if you want to see what is being shared in type, so all you have to do is take a picture of it, take it to your coach, say, hey, okay, this is what the doc says I need, or this is what he recommended for somebody else that has the same symptoms that I have. You want to make sure that you are here live with us Monday through Friday, except for tomorrow, 12 to 1 p.m. Pacific time. That's 1 to 2 Mountain, 2 to 3 Central, 3 to 4 Eastern, and 9 to 10 in South Africa. So if you're somewhere in between or even farther, check it out. We are here. As long as you have internet access, you will be able to join us here on Zoom. Zoom.dailywithdoc.com. And we have Albert down in South Africa, letting people in as they are coming into the waiting room and helping keep track of the things going on in the chat and sharing those questions that are coming up as well. So, folks, it takes a community around the world to create great things. And what we have created is the opportunity for you to find what is needed to create a better health journey. And U-turns are allowed. So if your journey to health isn't the greatest and you want to change that, give us 90 days. As Dr. Wallach says, 90 for life, 90 for days, and you will feel a difference. Major difference. In fact, I've heard you in the past, Dr. Wallach, give us 90 days and 90% of your poor health symptoms will be better or gone.
That's correct. I've been doing this a long time. And of course, when you give the good Lord's equipment to somebody, it always works.
That's right. And since we were designed by him, we need what he designed, and it just makes everything better, folks. So get back with the person that shared this program with you. Again, if there is nobody to thank, give us a call at 855-949-3377 to get connected with a certified holistic health coach who has been trained in Dr. Wallach's philosophies, approaches, and solutions. So my name is Becca Dukes. Thank you again so much for joining us. We will not be live October 4th, 2024. Myself, pharmacist Ben, and Ruth Ellen will be in Scottsdale. So if you are in the Scottsdale area, hey, send us an email and say, hey, and it may be possible we may be able to meet up and say, hey, just thank you so much again for joining us. AJ, did you have something you wanted to mention?
Be sure to follow us on Rumble, everybody, so that in case some of our shows are censored, because we talk about sensitive health topics, make sure that you're always able to get Dr. Wallach's message. And you can do that by subscribing on Rumble find us at Critical Health News on Rumble.
All right. Yes. You know, things that have been used for hundreds of years to help people, and they're going to put it on a censored list. So, folks, please follow us on Rumble. We're also on Brighteon. We're on Instagram. We're on X. We are on Spotify. We are on LinkedIn, Facebook, of course, YouTube with the most censorship, iHeartRadio. I mean, there's so many different places that we are on, and
Apple.
keep telling me I'm going to get a list. Apple TV, Roku TV. Just do a look or search for Daily with Doc. And if it's Roku or Apple, I think there's an app that you can download in order to see our show. So again, thank you so much. Thank you, Dr. Wallach. I know you've got another interview coming up here. We just want to say thank you for all you do.
I have a Zoom in South Africa.
No, Australia.
Oh, it's Australia. Well, it's
Australia.
Well, both of them begin with an A.
Yes, they do, and they're both pretty far south. So, hey, you've got this, Doc. Thank you so much for continuing to spread the good news of hope and empowerment for the world to hear. Until next time, folks, bye for now.
Bye-bye.
Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have the founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have the founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have the founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach.